right. All right. How's everybody doing? Thank you for joining me tonight. Really appreciate it. Before we get started, I just want to give you guys a chance to grab some stuff that we're going to be using. So first thing is either a foam roller, a yoga block. If you don't have either of those, I'll show you a way that you could just do the exercise without any equipment with your hand. And then another tool that we're going to use is a therapy belt or a yoga strap, stretching strap. You could also use a t-shirt or any material that doesn't have a lot of give in it. You're just going to be placing it around your neck. So I'll give you guys a minute to grab that. So we're going to start today's session by doing an exercise to build up the endurance of the small neck muscles in the front of the neck, your neck flexors. These are your deep neck stabilizers that help control a lot of the small individual movements from each joint to each joint throughout the neck. So how we're going to get those to turn on and activate is you're going to take your strap or a band and you're going to place it right in the middle of the neck. So it's going to be right where that mid-neck curvature is. The next thing that you're going to do, you're going to place just slight tension, not a lot of tension, through your hands, pulling out away from you on a 45-degree angle. You're then going to perform what's called a chin tuck. So I want you to think about bringing your chin towards your chest bone. And while you're doing that, you're also going to imagine elongating the back of your neck and the crown of your head going up towards the sky. That entire time you're holding that position, you have tension in the strap to help increase the load. You're going to keep your tongue on the roof of your mouth, lips together, and teeth slightly apart. You're going to hold that tension into the strap for 10 seconds at a time, and then relax. Let's go through a few repetitions of that. So place the strap where you need it to be. Pull out on a 45-degree angle. Chin tuck, pushing the back of your neck into that strap, elongating your neck up towards the sky. Don't forget to breathe. And relax. We're going to go through that 2 more times. And reset. Chin tuck. Good. Keeping that tongue on the roof of your mouth. You should feel the muscles on the front of your throat working the hardest. If you feel it anywhere else, stop the exercise, reset, make sure your chin tuck has proper form. So bring that neck a little bit longer. Good job, Kate. Good. Another way that you can do this if you don't have a strap, you can use your hands to add the manual resistance. So you can go from 2 areas. You can go from first areas of the forehead. So you're going to perform a chin tuck. Then you're going to take your hands. You're going to just indent the skin lightly, and you want to drag the skin up your forehead, up towards the sky. Keeping that chin tuck still. Holding that for 10 seconds. 5, 4, 3, 2, 1. And relax. And the other position that you might feel it a little bit more is right underneath the chin. So we're going to do the same thing we did for the forehead, but underneath the chin. So what you're going to do is you're going to do a chin tuck. You're going to take your thumb, you're going to place it on your chin, and you're going to try to pretty much give yourself a double chin. So you're indenting your skin and trying to drag that skin away from you towards the base of your chin. So my thumb is pulling out and up. And you should feel those muscles kick on right away. Here, your tongue's still on the roof of the mouth, lips together, teeth slightly apart. Good. And relax. So next exercise we're going to do is a bracing exercise for your lumbar spine, for the deep fibers of your core that run in your low back and to the front of the core. So what we're going to do for that, we're going to be laying down on the ground. You're going to grab a pillow just for your head to rest on. So you're going to be on your back. The first thing we're going to go through is how to fire a muscle called your transverse abdominis. Your transverse abdominis is one of your deepest core muscles that provides stability segmentally to your low back. That muscle wraps around your stomach across your waistline, whereas your rectus abdominis, the more six-pack muscle, runs vertically down from the rib cage down towards your pelvis. So I'm going to show you how to find that muscle and activate it on yourself. So you're going to feel for your hip pointers, which are going to be the most prominent bony parts of your hips. Once you feel like you have that area, you're going to go just inside, bringing your fingers towards the inside lip of the pelvis, towards the belly button. Once you get there, you're on top of the muscle. To activate the muscle, what you're going to do is you're going to think about bringing your belly button back towards the floor, towards your spine, and bringing your fingers closer together. So you're imagining your core tightening up, activating that lower abdominal wall, and you're holding that contraction. You should feel that muscle pop right into your fingers when you do so. We're going to hold this for another 10 seconds. 5, 4, 3, 2, 1. We're going to relax. We're going to do that one more time for a 30-second hold. When you're holding that brace, be sure to not hold your breath. You want to try to control that brace, that muscle, while still being able to breathe comfortably. So get back into position, get your hands on the bony prominences, the hip pointers on the front of the pelvis. Bring your hands just inside, so you're on the inside lip of that bony prominence. You're going to think about tightening up that lower abdominal wall, so bringing that belly button back towards your spine and holding this position. Again, make sure you're breathing full breaths all the way in, all the way out. It's important to have that control, be able to breathe and activate these muscles at the same time. Five, 4, 3, 2, 1, and relax. So the next thing we're going to do is build upon that exercise. So you're going to hold that brace and then bring both legs, hips at 90 degrees, knees at 90 degrees, ankles at 90 degrees. You're going to take your hands and you're going to flatten them at the end of your thighs, the front of the thighs. You're then going to apply a force that's going to be 90% up towards the ceiling and 10% down towards your feet. So pretty similar where we did with the chin tucks with the resistance on your own. You're going to just take up the slack of the soft tissue and think about dragging your skin on your thighs, away from you, up towards the ceiling. The moment that you take up the slack of that skin and start dragging the skin up towards the sky, you should feel your abdominal wall firing. While you're doing this exercise, I want you to notice if you feel your hip flexors working a lot. If you do feel your hip flexors working a lot, what usually is happening is you're pushing too far down towards your feet and not enough up towards the ceiling. So let's give everybody a try to feel the difference with that. So I like to maintain this for about 30 seconds if I'm doing it for a warm-up. If I'm doing it for an exercise, I'll perform it until I fatigue and can't have a proper form anymore. Your low back should be staying flat on the ground, not arching up off the ground during the exercise. Hold for another 5, 4, 3, 2, 1, and relax down. We're going to do that one more time, but now our hands are going to be crossed. So my right hand is going to be on the inside of my left thigh, and my left hand is going to be in the inside of my right thigh. So let's do a little abdominal brace. Get both legs, knees, ankles, in proper position. Right hand's coming on inside of left thigh. Left hand's coming on inside of right thigh. And I'm doing the same force here. So hands are tractioning my skin, dragging my skin up and out. 90% of my force is going up, 10% of my force is going out. Same thing as before. You want to make sure that you're not holding your breath here, that you're able to maintain that controlled contraction while still having full breathing abilities. Keep your toes pointing up towards your nose, tongue on the roof of your mouth, and feel that core work. These are not easy. And relax. And we're going to end this exercise by doing how we did it the first time. So hands are going to be just on the fronts of the thighs. I'm going to hold this for 30 seconds. Make sure that low back isn't coming off the ground. Maintaining hips and knees at 90. Looking good. And relax. So if you have a foam roller or a yoga block, you're going to grab it now. And now we're going to work on that diagonal reciprocal relationship between the opposite shoulder girdle and opposite pelvic girdle. So what that's going to look like is we're going to want to activate our core along that diagonal pathway. So you're going to take your foam roller, your yoga block, your hard surface, whatever you're pushing into, and we're going to do our right leg and left arm first. So you're going to come up into that position that we were just in. Right hips at 90 degrees, right knees at 90 degrees, right ankles at 90 degrees. You're going to take your left elbow and you're going to press it into your foam roller or yoga block. Your palm is going to be facing your face, and you're going to press in to one another. You're going to hold this for 30 seconds. If you feel like this is really easy for you, you can try raising your left leg about an inch off the ground and bringing your right arm all the way back above your head. Good. And relax. You're going to switch sides. So you're gonna bring your left knee and your right elbow together with your object in between them. My right palm is facing my forehead. And really feel that diagonal contraction from the right upper rib cage to the left lower pelvic girdle. Good job. Keep breathing. And relax. The next exercise we're going to do is a dead bug. So I'm going to show you 2 ways to do this. We're going to do a beginner and then a more advanced. So the beginner is going to look like heel taps. So what you're going to do is you're going to perform one of those abdominal braces. Bring your legs back up into that position. The arms are going to be pointing straight up, shoulders at 90 degrees in relation to your trunk. We're going to start by bringing our right heel and left arm down towards the floor. They're going to tap and come back up. So 5 on each side here. That's 2. Tap, 3. Tap, 4. Tap, 5. And switch sides. So right arm's going back, left heel's going towards the floor. 1, 2, 3. Keep that back flat on the floor. 4, and no holding the breath. 5. You can relax your legs back down. I'll show you the more advanced way to do it. So it's going to be the same starting position. Hips, knees, ankles at 90 degrees, shoulders at 90 degrees. But instead of just tapping your heel down to the ground now, you're going to straighten out your leg and keep it about 1 inch off the ground and still bring that opposite arm back. And then resume that start position. So let's do 5 on each side this way. If these are too hard for you, you're unable to keep your back maintained on the floor, just stick to the heel taps. So we'll do right arm, left leg first. 1, 2, 3, 4, 5. And switch, left arm back, right foot out. 1, 2, 3, 4, 5. Good. And relax there. How are we doing on time? Good. So we'll end with the plank. So there's 2 ways that you can do the plank. You could do it with your elbows fully extended, which is a little bit easier. Or you could do it with your elbows bent, forearms are accepting your weight. I also like to place a TheraBand around my wrists, and that helps engage my external rotators, my rotator cuff and shoulder girdle, to give me more stability through my arms to make the exercise a little bit more difficult. When you're doing that, if you're going to use the TheraBand around the wrists, you want to be sure that your hands are wider apart than your elbows. You want your elbows to be tucked nice and close, and your hands are going to be coming out to the sides to cue that external rotation. So we'll do 1 30-second hold here. Keep that glute activated. Slight pelvic tilt, bringing your pelvis up towards you. Keep that back flat, chin tucked, tongue on the roof of your mouth. You got 15 more seconds. 5, 4, 3, 2, 1. And relax. All right, and that is it for today's session. Does anybody have any questions?
Hi, no question, just thank you. I see, I don't know how many of us there are, but thank you.
Of course, Wendy. Thanks for joining. I really appreciate it.
Yeah, that was great. I'm actually, in full disclosure, I'm a personal trainer, but I'm dealing with my own back stuff. So I was like trying to make some time for my own self-care.
Yeah.
So put in a little structure. This was great. Thank you.
It's really cool. Hopefully you can join on a couple of the other ones. I think we have some back videos going on, some foot videos going on next week too. So, I mean, we're kind of our own worst enemy sometimes. We think we don't need it as much as we really do. We forget that even if you work in personal fitness or physical therapy or yoga and Pilates, you still got to do the stuff yourself. You know, you gotta really take care of your body so you can help others.
Yeah, I put everybody else's fitness appointments ahead of my own.
Yeah.
And so, yeah.
Nice.
So I think I did sign up for another one. Hopefully you'll see me. Thank you. I appreciate it.
Sweet. Sounds good, Wendy. It's a pleasure seeing you.
All right. Take care. Enjoy the nice weather.
Thank you. You too. Have
Bye.
a good one, guys. If you have any questions, don't be afraid to reach out.
All right. What was your name?
Joseph.
Nice to meet you. Thank you.
Of course.
Bye.
Bye. Bye, guys.
Thanks, Joe. Bye.
Bye.